Hello guys, welcome to my channel. This is Trendz. Today I'm going to talking about insurance barrier, contribution to health and depositor amounts commercially insured Americans and Canada. So basically the insurance company make our life different, and we also needed insurance policy. So before start video, if you new my channel, please subscribe my channel and press the bell icon for more new updates about insurance and health insurance, car insurance, and let's start. So here is the insurance barrier contribution health depositor company. The approach of prescription medical improves health outcomes and quantity of the life patients by helping and protect patients for the out of pocket cost and the hinder of the ability to access to other two important treatment. So here is the adequate insurance and coverage and equitable nexus increasingly shift and prescription of drug cost patients. And here is the social economically disadvantaged patients, recycle worth gap and lower income commercial unfavorable commercial insurance. Here is the high dedicatable health plan. Many common insurance design fracture lives and patients are able to afford their medicine and disproportionately and hidden are access to the disadvantaged communication. Higher education and health plans are disadvantaged and harm economically vulnerable patients by expanding them to the high out of the pocket cost of the hitter are access and other to the treatment and HD, PhD as and the associate of the lower levels of the medical and rates of the common chromes and conditionals. For example, cancer survival of the recall and ethics group of enrolled HDPH and more likely skip dose and their medication delivering prescription and the unable to afford specialist care of the comfort of the patients not enrolled HD HP 10. Furthermore, there is the effect of the magnificent among black patient and the related with the whole patients. Similarly, the switch for the traditional plans of the HDPHS and the associate with their proper entrance to the corridor and the medical access to the all recycle and the eternal gaps of the health serving account. Habit of the HPS and the health of the drug of the pocket cost and the medical, however, black hips on the lower and the individual are serial and likely and they are able to contribute to HSAS. Highly motivated to the incomes and the opportunity of the description labor market. Here is the formula of exploitation and the utilizer management of the advertising, entertaining and the consurance narrow of the limited provided network, more the equitable coverage and the better access to the medical and commercially insures patient and they achieve by the adopting partition and vertical that address health lectural challenge by the ensuring material and the age patients description marking and the loading to ensure insurance design adapt the legit and easily understood by the individual with the varying and the education level usually and the professional backward shares to saving pharmacy ability and the location network membership. Pharmacy deserts and the construction in the black and the Havinic health and the result will be limited pharmacy option. Among those, the communities make use of sharing and the predictable by the anchoring and the last of the fixed dollar capes instead of the insurance and the medical place limited of the maximum Amount of patients will be the asking pay to medical per prescription or the per month, and the annually would be able to all patients prediction they are out of the package expenses for the medical, and the patient's medical parts of the doctor established and announce the limited of the out of the packaging speed and the air width, and health insurance of senior of the individual disabilities are the overages higher costs. So here is the while you are no stage of the feed solution, and the improving health quantity and the across to the medical medicines reducing and insurance, and the social determinant of the health. And there is the another page like 5 number page including it, and the serial of the Callister and the Gollips and the Sigzan and the Western and Ginseng. So here is the Pharma medical insurance company like Barrier Insurance, and the local of the Muller J update included dependent owner farmers across and the rural America 2003 2008, and the review of the health policy 2008 number, and ability accent as their link like public health and the endure. So insurance bureau contributed and health insurance like big process to the shift practication of drug cost of the patients, increases application and the of dedication and construction to prescription drug coverage, along with other unfavorable feature of many commercial health plans created significant challenge with affordable and the many medical ability field adapted to the prescripted treatment due to systemic racism and the recycle gaps persisted, and the United States, and therefore blacks and brown family are likely to have ability resource to pay for out of pocket medication related expenses. Thus medication affordability challenge hits hardest on lower incluses communities who are disappointed no white. They has increases over the time to especially commons HD HPS further comparison the affected issues assistant to those type of the plan. Many cases there are no cops to out of pocket drugs cost and full plans that use coinsurance loading to large unpredictable cost of the pharmacy counter. Further coinsurance is offer collection and the percentage of a medication list price and may not reflect saving navigation by the health plan. Formerly exclusion can have a unequal impact on patients who can afford to pay full list price and of medication not coverages their health plans formulary, and the navigation the complex consumption of the expression process too can require high degree of the highly lecturer. Along more than 30% of the adults across lowest and the higher income across saying their insurance plans for a drug that prescription by their doctor, and they impact their restriction gather amongst economically disadvantaged communities. More than half of low income prescription do not feel prescription more medicals that are not covered by their plans. So that's the video. Has please comments in my videos. So that's it. Tata.